A little bit of background on me. I'm graduated University of Pacific Dental School in '98. Been practicing here for the last 17 years. Placed some implants in dental school. Was excited about oral surgery, but then when cosmetic dentistry came out, I really got involved with that, and really wanted to focus and create an office that was really just centered towards the restorative. And I sent out endo, I sent out oral surgery, I sent out dentures. I don't do any of that. It was strictly restorative, crown and bridge and restorative, and it was a very successful model. When cone beam technology came out, I had the opportunity to have a couple implants placed on myself about 10 years ago. I had a CBCT prior to the surgery, but it was really just to look at the dimensions because it was fairly new on the scene, but was not necessarily a prosthetic driven placement of implants. Subsequently, as I've seen the advancement in CBCT and cone beam technology, it piqued some interest, and as I was exposed to Sirona, and already having CEREC in my office, Sirona was a natural movement, and the idea of placing implants then was sparked, and some interest was brought into my, just to kind of bring a little bit more of a new spark into my practice. And we've been very successful in doing crown and bridge, but the idea that to do something different, do something a little bit more, and going back to the surgery and some things that I'd done back in the dental school days was of interest. Having said that, about 3 years ago, I attended a 3D summit. Was exposed to the cone beam. Prior to that, and the idea of integrating it with implants was out there, but not necessarily the integration. So I had a CBCT, I had a Galileos HD, or I'm not even sure which version I have, but one of the larger, the Comfort, I believe. And it was amazing to see what it did in diagnosing in my in my practice and with patients, being able to see things I'd never seen before. And what I really saw was a tremendous need to really include implants in my protocol and in my practice. And that's what turned over the next version, which was really getting into placing implants and integrating the software that is already included with the CBCT and Sirona, designing my implants through a prosthetic driven from my CEREC, being able to either email that out to Germany, and now they've got in Burbank, being able to email and get a surgical guide to do a fully guided system, or to also integrate and use CEREC guide, which is milling my guide here in the office, where I can design, mill my guide, place it. It's not a fully guided system, but a partially guided system. The osteotomies are guided, remove it, place the implant, and it was a really it really sparked my interest. I was excited about it. It's just something new that gets the blood pumping and brings in a new element to the office, which I really enjoyed. So I've been doing it for about 3 years. What I found is that as I've integrated CEREC, the first CEREC, I got a second CEREC unit, and now I have 3 CEREC units. I have 3 ovens. I have 2 ovens, 3 milling units. I have a CBCT, and the idea that in changing your protocol on how you schedule patients, changing on how you deal with the patients, it's not traditional dentistry. It's a new look, and that's what qualifies me and the idea that we've taken this technology, integrated in our practice, morphed our practice to involve this technology, and have created a completely different, in my opinion, a completely different presentation and delivery system solution for our patients through this technology. And that's what we've put together into a curriculum to train and give other dentists the idea of how to use this and how to practice at a different level and in a different manner that is exciting. It's predictable and very efficient.